And we're going to continue on our wellness condition journey here. And if you have callers on any topic, wellness or otherwise, just call me 800-313-9443. The first one I'm going to deal with eczema. Now, topically in eczema, you want to apply Silver 100 spray and then pregnenolone and curcumin cream to all the regions involved, at least 4 times a day. Then orally, you want to reduce histamine and block histamine with Allergon, which is an enzyme that gets rid of histamine. It's very unique. We have one lab in the world that makes it, so there's no copies. Allerblock is the best non-sedating antihistamine. And then you want to repair the tissues, phospholipids, with Omega Supreme Krill and Collagen Max. Krill, you take at least 2 soft gels twice a day, and Collagen Max. And if your budget permits and you've got a lot of skin damage, you want to add a few other things, including Mountain Red Velvet, 1 capsule. If you have 2 capsules twice a day, you open one under the tongue and hold for 10 minutes and then swallow the other. Gastrozyme, because often partial digestion of food induces food allergies. And you can also add NutriImmune to help heal the gut wall, which is often leaky, associated with large molecules getting through the immune system, through the splanchnic circulation and the Pear patches in the gut wall and the Kupffer cells in the liver that induce cytokines that cause eczema at a distance. Eczema also responds high-dose Power C to things that help repair the skin, such as ellagic acid in the DNA, and to malignant block, because remember now, there's often transformation of the DNA in the skin caused by the chronic inflammatory changes occurring. And one of the most important new additions is our Cell Defense Plus. This is a new form of curcumin. There's no other company that makes anything even remotely like this. The Cell Defense Plus curcumin literally repairs the DNA, turns off cancer cell transformation, gets rid of cancer mother cells, and helps to epigenetically stimulate your stem cells to regenerate any tissue and organ. So it is just amazing. So there's no reason to suffer or to take any drugs, including steroids, topical or oral, for eczema. None whatsoever. Next area is vision. And we tell people, we have some people with, vision loss due to macular degeneration. The first step is number 1, Vision Max, at least a capsule twice a day. Can-C eye drops, which stop the cross-linking of proteins in the eye that cause cataracts and eye inflammation. 1 drop in each eye 4 times a day. Neurogen to regenerate the nerve fiber tracts in the back of the eye and the rods and cones, along with Omega Supreme Krill, 2 soft gels twice a day. Ellagic acid for the small microcirculation, and to stop the free radical peroxynitrate and hydroperoxy radical cell detox glutathione, at least a capsule twice a day. In phase 2, we use lumen photon therapy, setting 3 for inflammation for regeneration of the eye, and setting 7 if there's increased intraocular pressure. Phase 3 is Summit to C mild hyperbaric oxygen therapy with ozone. As again, many people don't need all of these, but if you have a fairly serious condition, you will get a partial response from taking the first nutraceuticals, but if you've already lost a lot of your vision, unless we prepare you for what we call your own stem cells healing your tissues. And we can often do that with peptides. That's the next phase. We have DNA peptides that actually activate gene and tissue regeneration of any organ. And these peptides are specifically set aside by top anti-aging doctors in Europe and the Russian Academy of Sciences. They can actually regenerate tissues and organs. Phase 5 is the stem cell transplant. And we can use autologous stem cells where we multiply them in a lab and give them back to you. Or we can use stem cell lines like Stemedica in San Diego and their clinic in Santa Clarita, Mexico, or clinics in Europe. And I have connection to all these clinics around the world, so I can tell you, we do not get enough stem cells from umbilical cord stem cells or from same-day bone marrow. It's not a high enough concentration. The problem also is, if you don't have someone like myself who's very unique, to prepare your tissues, to remove the heavy metals, to restore the body, to turn off inflammation, to prevent diabetes or pre-diabetic inflammation in the body and mineral deficiencies, you can't possibly get well or stem cell transplant take. We need additional things such as ergothioneine like myco-D2, adequate levels of vitamin D3, adequate levels of all of the minerals necessary for stem cell transplants to take, like zinc and copper, and the proper ratio, etc. So it's a complex process to prepare the cells and tissues so that if you do get stem cell transplant, it will take. And we use transcranial micropulse, which is the Schumann resonance generator. We use also lumen photon therapy, and a combination of things to turn off is there's an autoimmune component to the condition. We use the malignant arrest, developed by Dr. Sven Giorgi, that actually invented the Krebs cycle. And we use other nutraceuticals to stop autoimmune inflammatory changes that can prevent you from healing. So, as I say, don't think that you won't benefit from the first stages, because if you have early stage disease, whether it's cataracts or macular changes, we can often reverse it with just the first few nutraceuticals. So, want you to understand that. Let's see. Oh yeah, we have a interesting protocol here for recovery from rosacea. Rosacea, by the way, is due to a spirochete. That's why the typical regular doctors will use Metrogel. It's not very effective, and it tends to stop working after a period of time. I recommend pregnenolone and curcumin cream to the skin after using a topical Silver 100 and or Nutridyne. You can alternate Silver 100 and Nutridyne on the skin. Orally, Allicin Med, Nutridyne, and Cell Defense Plus will help heal the skin. And then we want to stop the cytokines in the skin layers with Allerblock, Allergon, Power C, and ellagic acid to heal the skin and the DNA damage that's occurring. Again, remember, there's stealth pathogens that are a factor happening there. One of the best ways to actually get the taste of the Mega Muscles powder, if you're an athlete and want to build up muscle, is to use it in combination with Brain Mag and the Sports Energy Light. So I recommend the Mega Muscles powder, branched chain amino acids, which is the most powerful formula for building muscles, along with Brain Mag and our Sports Energy Light. And it's a powerful combination. Fantastic flavor, too. I mean, it's the best sport drink you can ever imagine. And I recommend you using our Pure Water System water as a basis for it. Pretty amazing. When we deal with somebody that has problems with recurring laryngitis, laryngotracheitis we call it, most commonly it's due to postnasal drainage and inflammatory changes. If you're a smoker, of course, it can be caused by local smoking of cigarettes. You can get laryngitis due to excessive use of the voice, too yelling, or singing too loud or incorrectly. The first thing I recommend is SinuPulse Elite. We're setting up a new sub-website with a few products from Amazon where we recommend products like our SinuPulse, our HydroFloss, trampolines, and a few other pieces of equipment we think are useful to get, and they provide the best price and the quickest delivery. We don't carry those particularly ourselves, but we will have a small Amazon site to carry a few pieces of equipment we think are helpful to deliver it. Like the SinuPulse Elite, we used to carry it years ago on our site until it became very popular. Same way as, by the way, the MyPillow, when it was a small company years ago. They used to be on our show regularly. And we may get Mike Lindell back on the program just for old time's sake. The SinuPulse, by the way, has a clear tip for inhalation therapy. It produces some small particles that are equivalent to the Omron, which is a typical medical device. You can use the SinuPulse Elite for irrigating your sinuses very effectively. You want to put 200 mils on each side of pure water system water or demineralized water. Irrigate with Nutridyne, say 30 drops or so in the chamber. Silver 100 vertical nasal spray, 6 puffs in each nostril while inhaling 4 times a day. Allergon, again, a capsule 3 times a day, and Allerblock. Cell Defense Plus to heal the membranes and also to regenerate the membranes of your inside nasal passages and your vocal cords. I recommend Collagen Max and Omega Supreme Krill for the phospholipids and the connective tissues healing, and use of Myco D2 with ergothionine for regeneration, because it contains ergothionine. The very first step in regeneration of any tissue is the ergothionine receptor on cells and tissues. Allicin Med to clear the chronic low-grade infection in case there's viral or mycobacterial or fungal infection on the vocal cords or sinuses with inflammatory molecules causing the laryngitis. And Nutridyne 15 drops in water 3 times a day. If the problem persists, I recommend an ENT surgeon look with a laryngoscope, if necessary, biopsy. I don't recommend, if you do have laryngeal changes that are heading toward cancer, to use any chemotherapy. I never recommend chemo, but recommend, firstly, our full protocol of malignant arrest, malignant block, ellagic acid, full vitamin K2, power C+, etc., and then recommend gene-based, off-label use of drugs and or nutraceuticals to reverse the genetics. Never recommend radiation, and only recommend surgery if you have to debulk a tumor or it's spread or metastasized, blocking an artery, vein, or nerve. But otherwise, our nutraceuticals are very effective along with targeted gene-based therapies. Never ever recommend, and I also recommend strongly for laryngitis that use GastroHeal tablets, chew 1 to 2 every 4 to 6 hours, and take CoQ10 ubiquinol, puncture a soft gel, and rinse it around your mouth and hold it there for 5 or 10 minutes, and then swallow and gargle with the CoQ10 ubiquinol, and it'll speed healing tremendously of the vocal cords. CoQ10 ubiquinol. So it's a good protocol. Then we're looking at. I want to review some of the steps because I get this call very frequently. People want to know if they do the steps because whether they're seeing a regular doctor or their internist or whatever, they're told that they want to do a stool test for hidden blood. When you're doing that, you want to avoid aspirin, vitamin C, red meat for 5 days. Then, if the stool test is positive, then you want to do a carcinoembryonic antigen in your blood with a sigmoidoscopy. And you want to make sure the scope is properly cold sterilized. Because you don't want to get carbapenem-resistant enterococci, which is very nasty. It can make you very sick or kill you. Then you want to have a stool. You want to have the next is if those tests are positive. You want to do an ultrasound of the abdomen and an MRI scan. You don't want to do a CT because the amount of radiation is pretty extensive. If the test, the CEA, is positive, the cut blood's positive, and you suspect a tumor on or a polyp on the ultrasound or MRI, then I would recommend a colonoscopy. So it's very rare to see a cecal tumor or what's called the hepatic flexure tumor over the right side, or the right upper quadrant. I strongly recommend that you don't do a colonoscopy as a first step. Follow this particular pattern. And I'm posting this all up on our wellness conditions, but also I'm going to do a video that'll go over on video on demand, because the current approach to doctors is to rush in. If you have an inexperienced technician or a resident doing it, they have a high risk of either infecting you with an incompletely sterilized scope with CRE or carbapenem-resistant enterococci, or puncturing the bowel wall, or causing a permanent dysbiosis of fungi and other organisms. And that can really screw up your bowel forever, or until you see somebody like me that'll clean it up. The next is people that want an alternative to lithium and Seroquel drugs. And I start off with recommending Calm Mind and Brain Mag for calming the brain down, and Mood Elevator, 1 or 2 soft gels 3 times a day, Cognition Plus, 2 capsules twice a day, and Brain Power. It's a starter program. There's more advanced things we can do for people that have want alternatives for bipolar mood disorders. The most important thing is to optimize brain magnesium levels with magnesium L3 and 8, normalize mineral levels. And the minerals we often will recommend for the brain are in Minerals Plus to normalize the conversion of amino acids to neurotransmitters. You won't hear this from the regular doctors because they just don't know it. They've never been taught or trained. Athletic performance. And I strongly recommend, if you're trying to take an antioxidant for stopping free radicals, NutriDefense is the most powerful antioxidant. Next is Omega Supreme Krill, and thirdly is NutriComplete. Power C Plus is very powerful. It's Cell Detox, Glutathione, and Nutritrala. Very important for athletic support for the drink. Again, Mega Muscles powder, which is our branched chain amino acids for muscle building. Sports Energy Light and Brain Mag. Remember, you want to build up and rebuild the tissues because you're going to damage them as you exercise. We recommend Collagen Max, Tendon Mender, Joint Performance, and Mountain Mid Velvet. You want to maintain highest levels of growth hormone and IGF-1, so microdose. 5 sprays morning, night, and before exercise. And if you're trying to lose weight or further increase athletic, and we call positive protein balance, it's 4 to 5 sprays every 3 hours during the day. Supernox 2 caplets 3 times a day. And then for mitochondrial support, we have mitochondrial catalysts, uridine, NADH, CoQ10, ubiquinol, and our VascuCare propionyl L-carnitine. And these are, we call metabolic and nutritional doping. You can also use mild hyperbaric oxygen for increasing athletic performance, and it makes a huge difference. So that'll optimize athletic performance tremendously. Once in a while we'll get someone questioning and sending me all their marketing they're hearing from yahoos out there that are marketing other products. And there's a lot of knockoffs to our cardiovasc. Do not listen to them. They have inferior products and they try to copy what Dr. Bill produces. A good example of the products over on Alex Jones' program and on Joyce Riley. They're inferior products. They do not provide the same power. They do not have the technology. They do not have the oversight as to how to use the products properly. And they don't have the same technologies of any kind whatsoever that are even remotely comparable. One of the more common things is silver. And we have all kinds of different marketing schemes. All other silvers other than ours is not an ionic silver. Most of the molecules are nanoparticle or colloidal, are inactive molecules of silver that have no biological activity except for the tiny portion that's in an ionic state, which, because it's not in a citrate complex, it immediately attaches to body proteins, chloride, fluoride, and bromide molecules and becomes inactivated. So our silver ionic citrate complex is hundreds of times more powerful than all other silvers. You can apply it topically, you can apply it in spray, you can put it in the eyes. Most people don't realize most eye conditions, including diabetics, are loaded to the gunnels with mycobacteria. Pretty well every tissue in the body in a diabetic is mycobacteria. They're also highly prone to immune system deficiencies, so they're more likely to get things like Toxocara, catus, and canis that can actually grow in the eye. They're also prone to other fungi in the gut, not just Candida albicans or glabrata, but many other types of fungi. And if you look even at the diabetic lipidicorum on the lower legs, it's a combination of anaerobic bacteria and fungi that are actually producing the changes in the legs and the skin. So the skin changes in diabetics is actually a local fungal infection with the mycelia penetrating right through the periosteum of the bone. So your doctor may not know this because they don't know advanced mycology or infectious disease, and therefore they're completely ignorant of the fact that these are fungal infections. And if you don't apply a oral, that's our Allison Med Nutridyne Silver, and then anti-inflammatories repair the DNA with pregnenolone and curcumin, you can't stop the problem. And if you don't repair the demineralization with things like MG12 products, you can't heal. Arthritis. And I did research in rheumatology with the head of the American and Canadian Arthritis Association, Dr. John Woodbury, back in the mid-70s. And I can tell you that the current approaches to arthritis are not significantly more advanced. RT3, reverse thyroid hormone. When we give people hormone support, it's important for menopause to use 1 to 2 pumps of DHEA and pregnenolone in the upper abdomen and lower chest, and also hormone synergy to stop the conversion of female to male hormone, and femgesterone, usually 2 pumps in the upper abdomen and lower chest as well. You can measure saliva levels, or if you have a QRMA machine, it's very effective to fix that. Congestive heart failure is increasing by 400% faster than any other heart disease. It's because of toxic demineralization of the soil and food, especially magnesium and other trace element deficiencies. It's increased toxic environmental stress to the mitochondria, because basically these are mitochondrial diseases, including scalar radiation from Wi-Fi networks, cell phones, etc., and radiotoxins from Fukushima, which will cause small fertility babies, congestive heart failure, and dementia. Which again, remember, these are all mitochondrial function disorders. Cardiovasc, 30 drops or 2 capsules 3 times a day. Supernox, Supernox, 2 caplets 3 times a day, etc. and VascuCare. So CoQ10 Supreme 2 soft gels 3 times a day, NADH, which is nicotine and dinucleotide dihydride, tablet 3 times a day, and Gamma E+. So all these will have effect. Then the ellagic acid for healing the DNA damage which occurs in the mitochondria, and Omega Supreme Krill. So that's all very important. If you just start off with the basics, including our magnesium glycinate malate, Cardiovasc, Supernox, VascuCare, Gamma E+, you're going to have a significant improvement in congestive heart failure. The current approach that many doctors use is to use powerful diuretics that further deplete minerals, beta blockers, which can cause, as I say, the quadrad of blind, impotent, stupid, and basically further compound the problems that are underlying. What you want to do is things that calm the central nervous system down, like Calm Mind and Brain Mag, and our mood elevator Posonol, which is an adaptogen to decrease CNS activity. You want to use natural ACE inhibitors such as Allicin Med. It's a natural ACE inhibitor. You want to use things that will increase diuresis, such as Power C Plus, to pull off excess fluids. And you want Vein Away, ellagic acid, and things that are going to heal the blood vessel walls. And you want the mitochondrial support, as I mentioned earlier, for supporting mitochondria, because congestive heart failure is basically a mitochondrial dysfunction disorder. It's very commonly linked to diabetes or prediabetes. So it gives you an idea what's going on there. Let's see. People want to know what is involved with the consultation. If I get an initial evaluation and it looks like your situation is very complex and it requires a lot more care than just an initial, don't panic that your initial nutraceuticals won't have benefit. In fact, I often err on the side of trying to over rather than under support. A lot of times people have remarkable improvement on just a few things like Cardiovasc, magnesium glycinate malate, Gamma E+, and things like forskolin for atrial fibrillation and early heart failure. We add VascuCare, carnitine, and CoQ10 ubiquinol to get the mitochondria going, and if need be, we add other things to improve the situation. But the main thing is that if I feel that once I've done an email back and forth and feel that we're not making sufficient progress, I'm going to recommend a full history, proper investigations, etc., and attempts to get you back on track. As I say, I connect with all the top clinics in the world, all the top doctors, and if I don't have an answer, I'll try to research and find an answer for you on any health problem you have. One of the things that people should be aware is that I have access to anti-aging molecules, peptides, and DNA modulators that naturopaths and other doctors do not have access to. You can use these at home in replacement for a stem cell transplant, and you can manage most of these things at home. People are also concerned about the cost of some to see mild hyperbarics. Not only the chambers are the least expensive, but they're also a total write-off. But if you lease them, your lease is also a total write-off against taxes. So I provide the documentation so you'll never have to pay out of your own pocket. It comes out of your taxes. So back in just a moment. We are going to be joined by Bruce McKeeman from Summit to Sea in just a moment, talking mild hyperbarics. And then Ryan Frace in the final hour. Coming up tomorrow, of course, first hour is KBU Care at our University. Tim Alexander, our historian, news blogger, and coming up on Wednesday, Harley, one of the most innovative people I know in terms of technologies. You've invented some amazing new technologies for mild hyperbaric oxygen, but even spin-offs for the mattress industry, for cooling mattress. You have the most ergonomic, the brightest, the biggest chambers, the only vertical Grand Dive chamber available, including the Grand Dive Plus. You've got pet chambers. It's amazing how useful these are. And I tell people, Bruce, we heal from the inside with NutriMeds, we heal from the outside with MG12, but the whole system requires not only fuel and the right nutraceuticals, it requires oxygen. And I know some people say, well, I can't afford a chamber. Anybody can afford even a lease for a few $100s a month if you have a serious illness. Don't go to Starbucks. Trim off the excess going out to eat. You've got to start realizing if you have a serious health problem that one of the primary things that's going to reverse many of the illness problems or even the loss of function you've had is mild hyperbaric oxygen. So Bruce, tell us about your chambers, what makes them so unique, and for those people who haven't heard before, how easy it is to acquire one of these chambers in terms of purchase. You've got the best prices, and also if they want to lease one, they can lease a chamber. It's a total write-off. I'll provide the documentation for them. Explain the reasons why your chambers are superior to all the other ones in the marketplace.
The hyperbaric is unique. We didn't say, let's go make a fortune on medical devices. We said, how can we get an affordable chamber into the hands of people who need them? Then, how do we get a chamber designed in such a way that people want to get into it? By making it light, bright, stereos integrated into them, cooling systems. And, as you were mentioning, I'm midway on this cooling system design with state-of-the-art heat exchangers with ultra-thin plates to pull that heat out of the air and have water circulating through to take it away out of the chamber. We just are loving our job because we love the people it helps. And we just spoke to a woman the other day who actually came over and used our chamber, and she was having lymph issues, the works. She said, I haven't felt this good in a long time. And I was only in the chamber for 60 minutes. And we also use the vibration plate technology. It just, there's no silver bullet in this world, and there's no excuse for doing only part of the job. You need all the things. I love your synonym ones. If you don't have everything, you're not going to get all the benefit.
Yeah, you're going to have a lot of improvement if we just, like, for example, I tend to overtreat, and I always get in trouble, too, with my wife, Michelle, and she says on Friday, just keep it to 3 things. I want to get people started. I'll give you an example. I had a lady, she has some spinal issues, and her son has MS. Now, she needs to understand if you're having inflammation anywhere in your body, whether it's spinal arthritis, chronic pain syndrome, or you have MS, which is an inflammatory autoimmune condition, or you have post-chemo, let's say you had radiation to your head and neck because you had chemo and radiation treatments, all of these require oxygen for healing. You heal further, faster, and more completely if you add it. Doesn't mean you won't heal. If you take our nutraceuticals, a lot of people say, I'm happy with what you gave me, doc. I can afford X, Y, Z for my congestive heart failure. But if you're in a very advanced stage of any serious illness and you're trying to get a more complete or more rapid recovery, when you add hyperbaric oxygen, it makes it much, much faster. You go faster, farther, and more complete in terms of recovery. Now, some people get offended by that and say, well, Dr. Deagle, I can't afford that. I don't know anybody that can't afford one of the chambers on a lease for a period of time, especially if it's a total write-off against their taxes. I'm thinking,
absolutely,
where are your priorities? Are you going to buy a new car this year or upgrade? Are you going to go on a trip? Do you buy Starbucks? Do you go to eat more than once a week? I tell people it's a matter of priorities. What are your priorities? Are your priorities, do you want to heal, or do you want to wait to the point where things get into extremis? And then the doctors, even if you have conventional medicine, if they're trying to recover you, your copays are going to be monstrous. For example, one day in hospital, even on a copay, can be $2,000 or $3,000 in hospital. That's your copay.
Yes. Yeah.
So
it's
why would someone think that when I provide a treatment that they can do at home under their own supervision is so easy? You can you can lay down in these chambers if you want to and sleep in them. You can have one that's a vertical chamber. You can actually go in there and go on your computer and do work or just listen to music or meditate. You have a new speaker system, too. I think you've announced that you're allowing people to have that. And I got mine. It's pretty amazing. You have these little Wi-Fi speaker bombs, and you actually just kind of click it on, and it'll go on your cell phone or your iPad. And you can have music inside the chamber. You can have relaxing music, ethereal music, whatever you want. You create the whole environment. In fact, one of my great people up in Edmonton, Canada, who's a really good listener over the years, he provided me years ago light system, an LED light, rotating light system to put in my chamber. So I have it hooking up on the ceiling of my chamber, and I flip it on, and it'll go through different types of colored light to relax you while you're in the chamber along with the music. So these are a whole environment for healing. So, and people need to understand it's beyond taking an oxygen mask and bouncing on a chamber. I was listening to Dr. Kondrat, who's got an alternative clinic in Florida for treating eye diseases, and there's some really good things he has and some things that I think that we can improve on. I don't think anybody will improve as well as bouncing on a trampoline with oxygen on your mask. You're not going to get the penetration through Henry's law into the tissues if you don't have mild hyperbaric oxygen. You have to have mild hyperbaric if you're going to recover from a serious, let's say, post-traumatic brain injury. We're going to give you nutraceuticals for it because there are no drugs to heal the tissue. We can give you stem cell transplants, but if the tissue doesn't have sufficient oxygen, the stem cells aren't going to take. I mean, you're only going to have a small percentage take, and your recovery will be limited. So when somebody says, well, I'm going to do a stem cell transplant for my spinal problems or my other things, I'm thinking, did we clean the soil up first? Did we provide the nutrients and the building blocks? And then do we provide the oxygen so when the stem cells got there, they had the energy to regenerate the tissue? I mean, these are simple questions, aren't they?
Yes, they're and there's simple answers to them, too. Listen to Dr. Bill.
Right. And the fact is I can validate this. And people say, well, I think that's just your opinion. Yeah, but my opinion's based on, 40 years plus of experience now, and being inquisitive and doing testing even before a lot of these so-called commercial labs. Before the labs were open for Genova Labs, Doctors Data, Metagenics, and even the Environmental Center of Dallas, I was doing work in environmental and metabolic research. Before anybody, we were the first to actually research at UCLA how toxins can induce autoimmune disease and cancer. The very first in the world to actually research and find hyperinsulinemia in diabetics, and I got persecuted for it. And again, I decided not to publish because I got persecuted by my colleagues who, this is, as I say, there's a difference between competency and arrogance. Because I'm very inquisitive and I always want to validate with science, you can actually say to people, well, how can you prove that works? I said, well, I'll tell you what, you need a testimony of one. If you take a child who hasn't spoken in years, and you have them go into a mild hyperbaric chamber, one of your chambers, for a week or two, and all of a sudden, after they've been in the chamber for a few weeks with their mommy, they come out and say a full sentence that's understandable in clear English, you know you've got something remarkable. Then you add it to our nutraceuticals. You give them the right nutraceuticals to provide the brain with the building blocks and nutrients, etc. You provide mild hyperbaric oxygen, their brain inflammation, their BOF starts to settle. Same way as grandma. If grandma's developing early dementia, what are you going to do? Arrange for her finances so you can shove her into a nursing home? But really, you need to regenerate brain tissue, myelinate nerve fiber tracts, oxygenate areas of the brain. Their microcirculation is shut off because she's got microhypoxia in different parts of her brain. If you simply oxygenate her brain, myelinate her nerve fibers, turn off her brain inflammation, you'll see grandma will remember recipes, her grandchildren, can take care of herself at home and doesn't have to for years go into a nursing facility. I mean, this is just logical, isn't it? And
no, it isn't.
Yeah, it's logical. The same way people will say, well, I'm in heart failure, and Dr. Deagle, I took 2 of those 3 things that you gave me, and it's not working. I'm thinking, this is only 2 weeks in, and you need to take a lot more than 2 or 3 things. Plus, you're probably going to have to add, if you're in end-stage heart failure, you're going to have to do other things to stimulate those mitochondria. It's like in your car. If you put the choke too tight on an old-style standard car, and there's not enough oxygen going into the fuel mix in your combustion chambers, why do you expect to get combustion and actually have the engine move forward? Why? I mean, it's just science, isn't it? And you start,
yes, it is.
Yeah, and when you open up the oxygen, components. Yeah. So tell us when you saw this happening, and you get testimonials, I'm sure, around the world. What kinds of stories do you have from people that say, this changed my life, this allowed me to recover when I was never getting better? I even have people that take our things for peripheral neuropathy. Peripheral neuropathy is taken off like a rocket as the population ages and turns diabetic. UCLA 6 weeks ago published a report that 69% of adults in California over age 30, 69% are either diabetic or pre-diabetic. Not 6.9%, 69%. What do you think is going to happen to those people as they get older?
They're going to get brains that can no longer absorb nutrients, sugar, glucose,
Right.
They're going to have to go on a ketonic diet in order to think.
Right. And the fact is that if we can start providing the right nutrients, turn off the inflammation. Remember, leukotriene B4, which is an inflammatory molecule, is triggered off by free radicals. The most powerful thing to block free radicals is, guess what? Oxygen. Then we have the best antioxidants. Then we have the minerals that can help support your glutathione peroxidase and superoxide dismutase enzymes. But if you don't have oxygen, I don't know why people expect to heal. The same way as the logic to me of, do we really have a healthcare system? It's just like, for example, I talk about this about other issues like geopolitical. I said, do we have a department of offense or defense? We don't have a department of defense. We have a department of offense. We don't have a healthcare system. We have what I call a pre-embalming system. It basically pre-embalms people with polypharmacy, plays around and does a faux kind of healing metaphor. Sometimes people will you won't die immediately in the emergency department, but you die months or years later of usually a whole menagerie of illnesses, many of them caused by the drugs or the fact they don't deal with the drugs inducing nutrient deficiencies or blockades. And you develop all kinds of complications, so your life becomes miserable in the last years of your life from all the polypharmacy. And simply, yes, there's a place for drugs, but it's very small. It's often a rescue thing where you rescue them with the drugs, and then you get off them as quickly as possible, because people in the first place, if they were taking the right nutrients, if they're getting proper exercise, if they're getting the right diets that contain nutrients, if they're getting oxygen, if they had an injury or had cancer or went through something toxic in their past, they'd recover. Their body would heal. It's like the old movie there called Field of Dreams, where if you build it, they will come. If you provide the oxygen and the nutrients, your body will just heal itself. It's a supernatural thing. It's like God set up the body to say, you have to have the oxygen, you have to have the nutrients present, and it'll just start healing. So Bruce, tell us some of the things that you can do with your chambers. You've got pet chambers. You've got one where you can even put a gurney inside it. So when someone that can't even mobilize themselves, you can roll a wheelchair inside your chambers. You've got the first one designed to actually put a wheelchair inside there. You've got chambers where you can sit up like the vertical grand dive I have, or the vertical grand dive plus. These are not claustrophobic. They're very bright. They're very large. You can have ones that lay down in. You even can set it up to have an electrical inlet go into the chamber. So if you want to have something in there that requires a direct power line instead of using a battery pack, which I use, give us an idea of the kind of range of chambers you have now.
Well, we start with a very affordable chamber under $4,000. Next month or so, it'll be released in a larger size, 26 inches in diameter. It's currently 23. That's the shallow dive. And then we step up to the dive chamber, which is going to be an amazing 33 inches in diameter for $7,500. Unheard of.
Yeah.
A competitor sells a 31-inch chamber for $21,000.
Wow.
And this is $7,500.
And by the way, their chambers are dark, hot, claustrophobic. Yours are not. Yours are bright, cool, inviting, non-claustrophobic. It's day and night. I mean, don't even consider buying alternative chambers. And by the way, you don't need to go to one of these clinics where they say you need 3 atmospheres of oxygen. I've talked to, in fact, one of the doctors, I'll mention his name, Dr. Harsh. He has a clinic down in Louisiana, and he said, I will not discuss anything to deal with mild hyperbarics. But the man he's got a vested interest. He wants to push 3 atmosphere chambers. The only reason why they have 3 atmospheres, and we've talked about this, is because if you put room air in at 3 atmospheres, you'll get nitrogen narcosis, so you don't want to do that. 1.3 atmospheres is all you require in order to have the biological effects of enzyme induction, tissue healing, and oxygenation beyond the range of the hemoglobin dissociation curve. So it's like any area. If you go to a candlestick maker, they make candles. If you go to a butcher, they're going to butcher. If you go to a surgeon, they're going to cut. If you go to a dermatologist, they've got their range of things that are part of their shtick that they have to do in order to be able to support their lifestyle and their current position in the medical system. What we want to do is empower you to say, what are the things you can do at home that are going to be superior, that'll heal you and prevent you developing illness. To me, it's very sad to see people developing polycystic organ disease, and they don't realize one of the simplest things is to start just oxygenating those tissues. And the analogy I like to use is that if you have 10% of your cells in your body are sick, they can't absorb the nutrients without oxygen. They can't heal themselves without oxygen. But if you provide oxygen and you provide metabolic support, all of a sudden now they absorb the nutriments we give them. They absorb the enzymes we give them. They absorb the minerals we give them when you provide oxygen under pressure. Those sick cells, when they start recovering, then your organs and tissues in your brain, your liver wakes up and says, hey, I can do this. I can wake up. I can grow and regenerate the organs of the liver, the kidneys, the myelination of the nerve fiber tracts. I can turn off the inflammation of your brain. It's called BOF. I can heal that leaky gut syndrome that's causing food allergy. I can fight that infection, chronic infection in your lower gut. It's just logical, isn't it? You know, if you provide oxygen to the sick cells, the well cells are doing fine. The problem is a lot of people say, well, I just take the nutrients. I say, well, that's going to help. But if the sick cells are not healing, your organs still stay below normal function.
Yeah, what is wonderful about the chamber is also the anti-inflammatory effect, which improves circulation, improves fluid flow, improves the lymph system. Just nothing it doesn't touch. You take inflammation out of the body, you've taken the cause of 90% of the diseases out of the body.
Yeah. It's amazing, isn't it?
Yes.
It really is amazing. Well, thank you, Bruce. I know you're a busy guy, but listen, if you have questions, contact me, or I'll give you Bruce's number. It helps for every health condition from spinal inflammation to MS. Yeah, I want people to kind of think positive. Many of the times people show tremendous improvement on just 2 or 3 of our nutraceuticals. A good example is a gentleman who contacted me last week, and he was in pretty serious end-stage congestive heart failure. If he just starts off with things like our Cardiovasc, Vascucare, which is propionyl carnitine, CoQ10 Supreme, CoQ10 Ubiquinol, the things to stop the blood vessel damage of the blood vessel walls and the mitochondria, ellagic acid, Omega Supreme Krill, things that support his mitochondria. He's going to show tremendous improvement already. But, you know, if you're out there listening and you're seeing yourself or a relative develop severe hypertension, or you're already developing renal problems, again, an example is we've had many people just take one thing. They take, for example, ultrathymine B1. If they haven't had a reduction in their microalbumin in their urine because they're diabetic or they've had decreased renal function, the next thing to do is add Vein-Away. Then finally, ellagic acid. And if you're trying to improve microperfusion, forest colon. Again, as we add layers of these, you're going to show improvement. And many times people say, well, that's enough. I'm happy. I've got 20 or 30% of my kidney function back, so I'm off dialysis. But if you want to get full recovery, you want to help us perhaps give you the specific peptides to regenerate your kidney function. You may want to try mild hyperbaric oxygen to get the maximum rate and speed and extent of healing in order for you to recover. And you want to also prevent future disease. We have people that take our ultrathymine B1, Omega Supreme Krill, and other nutraceuticals for peripheral neuropathy, and they say, well, my doctor doesn't know what to do. Your doctor is completely ignorant. You need to understand that. And that's not meant to be an insult. It's meant to be a revelation that the current healthcare system is of unqualified people who don't know what they're doing. They have a small bag of tricks of drugs. If you don't satisfy that, they say it's your fault, or your diet is not good enough, or your lifestyle, or you have PPP, piss-poor protoplasm. You have to understand the medical profession has a vested interest in their standard allopathic approach, and if you don't fit that one-size-fits-all, tough on you. And people find out, well, that's a really insulting doctor. My doctor's a good doctor. They may be a nice person, but they're an ignorant person. They don't understand these things, and because they're going to put you in grave danger, and they're going to expose you to treatments that are not going to be effective. So it's important to understand this very important principle. And if you want me to talk to your doctor, all you have to do is ask them permission to say, can Dr. Deagle talk to you and explain these technologies? And I'll do it, free. But I need to get their permission first, and their phone number and email contact. Most of the time, doctors are very remiss to let me explain things to them. When they're usually pretty open, and I find, it doesn't matter if they're a plastic surgeon, orthopedic surgeon, whatever, I will make any health professional, chiropractor, naturopath, doctor, surgeon, dentist, whatever, a better doctor in 2 hours if I can get a chance to talk to or communicate with them over a period of time. And that doesn't matter which country. Believe me, there's no shortage of ignorance or stupidity everywhere. And the problem is they haven't asked tough questions to take them out of their comfort zone. So you may find this hard to believe, but I can prove it with imaging studies, analysis of lab results, oxidative markers, QRMA, advanced technologies, so functional medicine testing. I can prove it. In every sphere of every area of medicine or healing, I can prove it. Again, if you want to contact me, go to NutriMedical.com. Everybody gets a free initial consultation to get their protocols going. If your condition is very complex, I'm going to recommend a consultation. But everyone can get a free email, consult, and upgrades to your nutraceuticals. Just communicate with me and I'll help you. It's part of our ministry. Back in a moment with Ryan. You don't want to miss it. There's a NutriMedical Report, NutriMedical.com. Get all your nutraceuticals at 888-212-8871.